Okay. I see people are entering the room. So I'm going to give it a little bit more time just to let more people in. Thank you, everybody, for being prompt and on time. Fantastic. Fantastic. All right, even more people are coming in. Great stuff to see. All right. Okay. I think we could get started. And I thank you all very much for being on time and joining me on this exciting class. So we're talking about a very important topic. Should you take Medicare? And this is certainly going to be relevant as we approach open season. And some of you are going to be making your FEHB decisions. Have this Medicare conversation in mind when you make your FEHB decisions. Well, especially those who are eligible for Medicare. Some of you are not yet eligible for Medicare, but those who are going to be approaching Medicare age, whether it's going to be within the next year or maybe in the short future, you should definitely be having this Medicare conversation in mind as you approach open season, this year's open season and future open seasons as well. This is a great conversation. I'm excited to share with you guys the information, but before I share with you the information, the first thing I want to do is give a shout out and a thank you to my clients and my members. As I like pointing out, these webinars do not happen in a vacuum. These webinars are happening because I have people supporting me. Those are my clients. Those are my members, the people who work with me on financial planning. If you are not yet a client or a member, you may want to consider becoming a client or a member. And in order for you to request a meeting with me so you can learn more about becoming a client or member, I'm going to publish a learn more button on the right-hand side of the screen. You guys should be able to see something on the right-hand side. If anybody here is interested in learning how to become a client or a member, just click that learn more button and you can request a meeting and I will go through what it takes to become a client or a member. And if you know somebody who is already a client and a member, can you do me a favor? Can you give them a hug and say a thank you from me and also a thank you from you as well? Because again, these classes do not happen in a vacuum. They happen because I have people that are supporting me and I'm very, very grateful for that. Thank you so much. Okay, so without further ado, let's dive in to this very complicated topic, which is Medicare. Do you need Medicare? Medicare is very, very complicated. I've done a lot of research on Medicare. I've read through the Medicare websites. I've read through the Medicare brochure. I don't know if you guys ever seen this brochure. So for those who are approaching age 65, this brochure, Medicare and You, they mail it out to you as you approach your 65th birthday. This brochure is about this thick. And the nice thing about the brochure is that you only have to read it once, because every year they put out the brochure anew. And every year there's always just a few pages of what's new in Medicare. There's a few pages. That's what those pages are called. What's new in Medicare. So long as you remember what's old and you just read the few pages what's new, you'll be up to date. So I've read through this brochure many times. So I'm going to pass along to you guys not just the research that I've done on Medicare, but I'm also going to share with you the research that my clients have done. Many of my clients are retirees or pre-retirees, and they have skin in the game, let's just say, okay? And so they are very motivated to get as accurate information as possible. They've done a lot of due diligence for themselves. So I'm going to share with you guys not just the research that I've done, but also my clients in the trenches work. Let their long road lead to your shortcut. Okay, this is going to be a very, very good, juicy conversation. And let's talk about the different parts of Medicare. I'm sure you guys have heard that there are many parts of Medicare, many parts of Medicare. There's Medicare A, B, C, D, E, F, G, and it keeps on going. There's many, many different parts of Medicare, okay? Now, in this class, I'm not going to focus on all the various parts of Medicare. I'm going to focus primarily on the four that are on this slide. Part A, which is the facilities, the hospitals and the facilities. Part B, which is the practitioners, the doctors. Part D, which is prescription drugs. And then there's Medicare Part C. Medicare Part C is what's known as Medicare Advantage plans. Medicare Advantage plans, they sound similar to the Medicare supplemental plans or Medigap plans. They sound similar, but they're not exactly the same thing. When you have Medicare Part C, first of all, you're going to have Medicare Part A and Part B in order to have Medicare Part C. So again, if you have Medicare Part C, you have to have A and B, and then you'll have C. So if you have A, B, and C, one of the questions you're going to be asking yourself is, do I need to have FEHB if I already have Part A, B, and C? And as I'll show you just a second, that if you have Medicare A, B, and C, FEHB will allow you to suspend your FEHB. Okay, I'll talk about that in just a second, but come back on track. What's the difference between a Medicare Advantage plan and a Medicare supplemental plan or Medigap policy? So I'm not going to get tangled up in it. It's a very, very complicated answer. The simple answer is as follows. When you have a Medigap policy or one of those supplemental things, you will have Medicare and a supplemental. Those are two separate plans. When you have two separate plans, one of those plans is going to be a primary. One of those plans is going to be a secondary. Now, which one's primary or secondary? We're going to talk about that in just a little bit. But when you have a supplemental or a gap policy, you're going to have two plans, Medicare and a supplemental plan. However, when you have Medicare Advantage, you don't have two separate things. You don't have a primary, secondary relationship with Medicare as your primary and the Advantage plan as your secondary. No, 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 no. When you have a Medicare Advantage plan, there's no more primary, secondary relationship. The Medicare Advantage is the only insurance you have. And you access Medicare through the Medicare Advantage plans. I know it's a complex explanation, okay? One of the differences is if you're going to have a Medicare Advantage plan, then the doctors in that plan necessarily have to be participating in Medicare, okay? Because that's the way you access Medicare. There's no two plans. It's not like you have Medicare and something else. No, no, no. You're going to have Medicare Advantage, and those doctors need to be Medicare participatory doctors. As opposed to a supplemental, the doctor could be somebody who's out of network, not necessarily participatory. Okay. Anyhow, I'm trying to be as short-winded as possible because I don't want to get tangled up in that. I'd rather focus on the meat and potatoes. But just so you guys know, in order to have Medicare Advantage Part C, you have to have Medicare Part A and Part B. And as I said a second ago, if you're going to have Medicare Part A, Part B, and Part C, it really begs the question, why should I also have FEHB with all those other plans? You're right. If you have Part A, Part B, Part C, it does beg the question, and it might not be justified for you to have FEHB as an additional plan. So if you're going to have Medicare A, B, and C, you will be allowed to suspend your FEHB. Not everybody is allowed to do this. Most retirees are not allowed to suspend their FEHB coverage. If you suspend it, usually you're not allowed to get back in. There are a couple exceptions where you're allowed to suspend your FEHB coverage. And when you're in suspension, it basically just puts your FEHB on pause temporarily. And in the future, you could re-enter FEHB during open season. Medicare Advantage allows you to suspend your FEHB, and also TRICARE allows you to suspend your FEHB. So if you have Medicare Advantage and if you have TRICARE, those are the couple of instances where you'll be allowed to suspend your FEHB to use those other things. And while your FEHB is in suspension, you don't have to pay for your FEHB. It's just on pause for that period of time. You could re-enter at a future open season. As you guys can see on this slide, FEHB does offer a couple of plans that are Medicare Advantage plans. So you actually can find Medicare Advantage plans in FEHB. But again, we're going to talk about whether or not you even need to have a Medicare Advantage plan, whether you need to have even Medicare if you already have your FEHB. That's going to be one of the big conversations, or probably the big conversation we're going to be having today. I hope you guys are following me. I know I'm already crashing you guys with a lot of tedious information, but stick with me. It's going to get juicier. Okay. As I mentioned, there are the different parts to Medicare. Part A, Part B, Part C is the Advantage plans. And then there's Part D, which is prescription drugs. I want to talk about the pricing of those. Let's start with Part A. So Part A, as you guys can see on this slide, Part A is free. Part A is free. Or actually, what I really should say is Part A, you're paying for it right now. You know your Medicare tax? Every pay period, you are paying Medicare tax. 1.45% of your pay goes to Medicare every pay period. You've been paying into it for 30 years already. There's no free. However, the Part A premium, you don't pay an additional premium. You just have the Medicare tax, but you don't have the premium. So there is no premium for Part A. There are, I should say, some people that have to pay for Medicare Part A, but I don't believe that's anybody in this room. It's very, very rare that I meet somebody who has to pay for Medicare Part A. Usually it's somebody who is not an American citizen, never paid into Social Security, Medicare a day in their life. So if you have somebody who's not an American citizen and never paid into Social Security and Medicare a day in their life, so that will be a situation where you might have to pay for Part A. But most people in this room, you're not going to pay Part A. Part A is going to be free. Part B, however, that's going to cost you some money. How much is Part B going to cost? So if you guys look on this slide, on the right-hand side, you'll see the monthly premiums for Part B and for Part D. The monthly premiums are based upon your income from 2 years prior. 2 years prior. By the way, that's always the case. With Medicare, Medicare premiums are always based upon your income from 2 years prior. Now, if you guys heard what I just said, you should be outraged. Why should you be outraged? Well, what I just said is your Medicare premiums are based upon your income from 2 years prior. Why is that outrageous? Because, Stephen, it could be that now I'm retired, but 2 years prior, I was still working. Are they going to base my Medicare premiums in retirement based upon my income 2 years ago when I was still working? And the answer is yes. Yes, that's exactly what they're going to do, unless you kvetch about it. What do I mean kvetch about it? You actually have to let Medicare know that you had a life event. Okay? You have to let them know you had a life event. Now, what life event did you have? What life event did you have? You can't just lie to them. You can't just make up a life event. What life event did you have? So believe it or not, retirement, or rather I should say, a reduction in income, that is a life event. When you retire and your income goes down, you could then use that as a life event, as a qualifying event, which Medicare should then use to adjust your premiums. Now, you're going to have to let them know that you retired and that your income goes down, and you're going to have to fill out a specific form. If you guys are interested, the form that you're going to want to fill out to get Medicare to pay attention to your life event is SSA Form 44. Let me put this in the chat box. In fact, I'm going to put this as a link in the chat box. Here it comes. If anybody's interested, I just put in a link inside the chat box. It's SSA Form 44. So if you guys submit that form and let Medicare know that you had a life event, they will adjust your premiums based upon your new level of income. However, if you do not let them know that you had a life event, then they will just continue charging you based upon your income from 2 years prior, even though 2 years prior you might have been working. So let's come back to the slide over here. If you guys can see the column that says Part B, your monthly premiums for Part B, your monthly premiums based upon your income levels. So while you're working, if you get Medicare while you're working, you're probably going to be in around the middle to lower brackets. When I say lower, I mean like lower down on the slide. I should say the higher brackets, okay? So if you're going to be collecting Medicare while you're working, you'll probably be in that, let's say, the third or fourth or fifth row. That's probably where you're going to be. The third, fourth, or fifth row is where many of you are going to be if you're getting Medicare while you're working. And you'll see the monthly premiums. So while you're working, you may be paying $300, $400, $500 a month. That's per month, per person. Let me say that again. Per month, per person. There's no family plan with Medicare. There's no self plus one plan with Medicare. Each spouse, if the spouses pick up Medicare, that's a big if, but if the spouses pick up Medicare, each one of the spouses is going to have their Medicare premiums. Okay, so if you are a married person and you're planning on having Medicare, you could take these premiums and multiply it times 2. And that's just your Part B premiums. There's also something which is your Part D premiums. Your Part D premiums are, if you guys can see on the slide where it says Part D on the top, the Part D varies by plan. The average Part D plan, remember, Part D is prescription drugs. So the average Part D prescription plan is about $43 a month plus an IRMA surcharge, right? What does IRMA stand for? IRMA stands for, I don't even remember, like income-related monthly adjustment, something, whatever it does. It means something, okay? So you'll take your $43 a month plus the IRMA surcharge. If you guys can see in the Part D column, you'll see the plan premium, which is $43 a month for most people, but that's the average. And then you're going to have the IRMA surcharge. So for some of you, it's going to be $12.40. Some of you, it's going to be $32.10, $51.70, and so on and so forth. So again, while you guys are still working, if you get Medicare while you're still working, you're going to be paying about $300, $400, $500 a month for Part B. And then for Part D, you're going to be paying about $43 a month plus another $30. So that's about $70 to $90 to $110 per month per person. That's just for Part D. If you're married, take these numbers, multiply it times 2. Now, as we all know, when you retire, your income is likely going to go down. Most of you, when you retire, your income is going to go down. However, let me remind you, it's only going to go down temporarily. Before the age of 72. However, does anybody know what happens at the age of 72? At the age of 72, that's when you have your mandatory distributions, required minimum distributions, RMD, required minimum distributions. Exactly. And the RMD, just so you guys know, the way they calculate the RMD, it's a percentage of your traditional account values. So if you have traditional TSB, traditional IRA, whatever your traditional account values are, your RMD is a percentage of those traditional account values. So for example, the first RMD at the age of 72 is 3.9%. 3.9%. So if you have a $1 million portfolio at the age of 72, you're going to have to take out 3.9% of $1 million, which is $39,000. And by the way, at the age of 72, there's a very good chance that you'll have a $1 million portfolio. Some of you already have a $1 million portfolio now. Now you have $1 million. Guess what? If you have $1 million now, by the time you're 72, you possibly have $2 million, maybe even closer to $3 million. I'm not even joking about this. I know it's hard to imagine, especially with the market acting so crazy these days. But statistically speaking, historically speaking, the market doubles every 7 to 10 years. So if you have another 10 years before you reach age 72, whatever your portfolio value is right now, there's a very good chance it's going to double. And guess what? When those RMDs kick in, your income's going to go up. And when your income goes up, that's going to push your Medicare premiums up as well. If you guys want to do a good exercise, I would encourage you guys to do the following exercise. You can even do it now while we're in class right now, or you could do this on your own. The exercise I would invite you to do is I would invite you to compare the Medicare premiums on a monthly basis to your FEHB premiums on a monthly basis. So if you guys want to look at your pay stubs, anybody here who has a pay stub, you take out your pay stub and look how much your FEHB is costing you right now per pay period. And what you need to do is you need to take what you're paying per pay period and convert that number into a monthly number. Does anybody here know how do I convert a pay period number into a monthly number? So what you do is you take the pay period number, you multiply it by 26 and divide it by 12. So everybody here, if you'd like to do this, take what you're paying for FEHB right now per pay period, multiply it by 26, divide it by 12. That is your monthly FEHB cost. And I want you to compare your monthly FEHB cost to the cost of Medicare. Oh, and by the way, if you have an FEHB plan that is self plus one or family, it could very well be that for Medicare, remember, there's no self plus one or family plan for Medicare. So for Medicare, what that's going to mean is you're going to need to get Medicare for yourself and then Medicare for your spouse. So if you're comparing the numbers, look at your FEHB numbers and compare to your Medicare numbers. And if you're married, your Medicare numbers should be times 2. Many of you, if you do this math, many of you will discover that FEHB is usually less expensive. It's not always less expensive, but in many cases, FEHB is going to be less expensive on a monthly basis. And we're going to keep that in mind, that FEHB is going to be less expensive on a monthly basis. Because towards the end of the class, I'm going to do a little bit of a comparison. We're going to try to compare Medicare and FEHB as best as we can. You know, it's not always apples to apples, but we're going to try to make it as apples to apples as possible. One of the points of comparison is going to be price. So don't let me speak on your behalf. You guys can look at the numbers on your own. But in general, many people will find that their FEHBs are going to be less expensive than Medicare. Let's keep that in mind. Okay, let's go further over here. What does Medicare cover? What does Medicare not cover? So I'm going to go through these next couple of slides very, very quickly, just because I want to get to the meat and potatoes. So Medicare Part A, remember Part A is the facilities. So what is included in Part A coverage? So Part A coverage includes, on the left-hand side of the slide, it includes inpatient hospital care, skilled nursing facility, hospice care, home health care. Those are included. However, look at the next list, which is not included. These things on this slide over here are not included. So, for example, private room and nurse, a television or a phone, not included. Custodial or unskilled care, not included. By the way, custodial unskilled care, that's another way of saying long-term care. Long-term care is not included in Medicare. Medicare does not pay for long-term care. Now, by the way, even though Medicare tells you that they don't pay for long-term care, let me tell you what I discovered. One of my relatives is the controller of a nursing home. And he's involved in all the accounting, all the billing. He's involved in all that stuff. And he tells me Medicare will pay for nursing home care. However, there's a couple of caveats. Number one, the long-term care has to be accompanied by a qualifying medical event. So it's not just pure long-term care. It has to be some medical need that required that long-term care. That's number one. And number two, it's limited to 100 days per year. So that means if a person needs long-term care and they need to go to a nursing home facility, if that long-term care was accompanied by a qualifying medical event, and again, I don't, even the full definition of qualifying medical event, that's something to ask an insurance professional, okay? But if he has a qualified medical event, then Medicare will chip in for the nursing home expenses, but that is limited to $100 a day. Okay, $100 a day. I'm sorry, not $100, excuse me. That's limited to 100 days a year. Excuse me, I missed my spell. That's limited to 100 days a year. Next on the slide, overseas care. Will Medicare cover you overseas? No, it will not. No, it will not. Okay, so let me back up. If a person has Medicare Part A and they go to a facility, are all the expenses covered? No. If a person has Medicare Part A and they go to a facility, there are still out-of-pocket expenses. So on this slide, I show you typical hospital expenses that you may incur if you ever go into a hospital with just Medicare Part A coverage. So you'll have a deductible that covers the first 60 days. That deductible amount is $1,556. Okay? You have to pay a deductible for every benefit period. And by the way, for those who don't know what benefit period is, in Medicare lingo, a benefit period is a 60-day period of time. So that means if a person went into a hospital and they came out of the hospital and they waited more than 60 days and then went back into the hospital, they will have to pay another deductible. But if they came back within 60 days, then it's still part of the same benefit period. They will not have to pay another deductible. So the first 60 days are covered by the deductible. Then the next days, 61 through 90, are a daily rate of $389, which is relatively high. And then days 91 through 150, the lifetime reserve days. That's another daily rate, a much higher daily rate, $778, which is very high. And then after the lifetime reserve days, you pay all costs. There is no maximum out of pocket. Have you guys ever heard this word before? Maximum out of pocket? This is one of the most important words in the entire Medicare conversation. So let us define this very important term, maximum out of pocket. The maximum out of pocket is the maximum amount of money you will have to come out of your pocket in any given year should you have a catastrophic medical event. It is a catastrophic cap. It is the most you could possibly come out of your pocket in a given year if you had a catastrophic medical event. Every single one of your FEHB plans has something called a maximum out of pocket. Every single one of your FEHB plans. That means there's a catastrophic limit. That means even if you had the most catastrophic, disastrous year medically ever, there's a cap to the amount that you have to come out of your pocket. Every FEHB plan has a cap, has a maximum out of pocket. Medicare has no maximum out of pocket, which is outrageous. Outrageous. No maximum out of pocket. Let's keep that in mind. It's a very important term. Next, Part B coverage. So remember, Part B covers the practitioners. That includes the doctors, the outpatient care, the medically necessary services. I love that word, necessary. What's not necessary? What's not necessarily, apparently it's not covered by Medicare. Well, I have a list over here of things that are not covered by Medicare Part B. So for example, eyeglasses, hearing aids. So if you can't see and you can't hear, that's not necessary, is it? Nah. Also, routine physicals and many immunizations. There are many things that are not covered by Medicare. Also, routine foot and dental. Is there anybody here who's planning on having any dental work in retirement? Well, guess what? Medicare is not going to cover your dental. Okay, let me remind you. Part B is not free. It costs you money. It's based upon your income from 2 years prior, as we said. Also, there's a very small deductible, a $233 deductible. After the deductible, it goes into a coinsurance, 80-20. That means whatever the medical bill is, they pay 80% of the bill, you pay 20% of the bill, but once again, there is no maximum out of pocket. Ooh, remember that word, maximum out of pocket? Let me give you a story. About 8 months ago, I was giving this class virtually. There was somebody in this class from New Mexico, virtually in the class. And this person told me that they had some heart complication issue. It required them to go through a number of procedures. And they got the letter in the mail the explanation of benefits. And the explanation of benefits described the cost of all these services that they received. The cost was over $500,000 for all of their heart stuff that they had to have done. Now, thankfully, they had FEHB. So FEHB knocked down that cost tremendously. Instead of this person having to pay $500,000, this person, they were knocked down to just a couple of $1,000s, or maybe like $3,000 or $4,000 out of their own pocket. Okay, which is obviously fantastic, and that's why we have insurances for exactly situations like that. But that's because FEHB has an out-of-pocket maximum. There's a cap to how much can come out of your pocket. Medicare has no maximum out-of-pocket. So imagine a person has a $500,000 bill. It's true, Medicare will pay 80%, which is very good, but the other 20% is on the patient. What's 20% of $500,000? $100,000. It's a lot of money. And even if you tell me, Stephen, no, the $500,000, Medicare would have knocked down the price from $500,000 down to $200,000. Let's just say. Okay, fine. The patient still has to pay 20% of $200,000. Isn't that $40,000? Wow. Okay, I hope I'm making sense of this. I hope you guys are hearing me. There's no maximum out of pocket with Medicare. That is a very scary thought. Okay, let's go a little bit further. You have Part D coverage, which is prescription drugs. And for the sake of time, guys, I'll let you guys, read this on your own. Okay, but I want to just skip over the slide because I want to talk about how to enroll in Medicare, and also should you enroll in Medicare, which is probably the prime reason why you guys came to this class, to figure out should you enroll in Medicare. So let's talk about how to enroll, and then we're going to talk about should you enroll. So how to enroll in Medicare. There are 3 enrollment periods: the individual, the general, and the special enrollment. The trickiest one is the very first one, the individual enrollment period. So let's start off with the individual enrollment period. Medicare is going to start kicking in at what age? Who knows? What age does Medicare start kicking in at? And the answer is 65. 65. Medicare starts kicking in at 65. As you approach your 65th birthday, Medicare is going to start spying in on you to see whether you are collecting Social Security or not. Again, Medicare is going to check to see whether you are collecting Social Security. If you are 65 years old and collecting Social Security, you will automatically be enrolled in Medicare, both Part A and Part B. They will mail you your Medicare card, Part A and Part B. They will start deducting your Part B premiums from your monthly Social Security benefits. So if you are a 65-year-old collecting Social Security, you will be automatically enrolled in Medicare Part A and Part B. Now, the question is, once you're automatically enrolled, can you disenroll? And the answer is yes, you can opt out of Part B, but you cannot opt out of Part A. Part A is tied to Social Security. If you're a 65-year-old and you are receiving Social Security, you must have Part A. There's nothing you can do about that. Let me say that again. Medicare Part A is tied to Social Security. If you are a 65-year-old collecting Social Security, you must have Part A. There's nothing you can do about it. You can opt out of Part B. You just can't opt out of Part A. And I know what some of you are thinking. Some of you are thinking, Stephen, that doesn't bother me. So what? So they forced me to have Part A. Part A is free, isn't it? So if it's free, why do I really care? You know what? If it's free, I'll take 2 of them. So let me share with you guys something. Even though Part A is free, meaning that they don't charge you premiums, however, there is a cost to Part A. Not too many people are aware of this cost. What is the cost of Part A? The cost is that once you're enrolled in Medicare Part A, you can no longer participate in an HSA, a health savings account. Now, are you interested in an HSA? Is an HSA a good thing and not a good thing? I'm going to have to leave you guys with a cliffhanger there. Next month's webinar is going to be about HSA versus FSA. So we're going to have a whole discussion, HSA, FSA, next month's webinar. Okay? But just so you know, I'm a big fan of HSA. And if you have Medicare Part A, you can no longer participate in an HSA. Okay? So that is going to be a little bit of a downside. So when they say Medicare Part A is free, it's not exactly a free, because it does cost you the ability to participate in HSA, and there are many benefits to the HSA. Okay, so we have to leave that aside for now. So if you are age 65, you will automatically be enrolled in A and B. You can opt out of B. You cannot opt out of A. That's if you're collecting Social Security at the age of 65. But if you're not collecting Social Security at the age of 65, then you're not going to be automatically enrolled. Then you have to enroll yourself. And you have a 7-month window to enroll yourself. So again, on the left-hand side of this slide, on the bottom of the left-hand column of the slide, if you are not collecting Social Security, well, you're going to have a 7-month individual enrollment period. The 7-month enrollment period is the month you turn 65, the 3 months before, the 3 months after, 3 + 1 + 3. That is your individual 7-month enrollment period. If you miss the individual enrollment period, don't sweat it. Don't worry about it, because every year there's an open season, and that's the middle column. The middle column is a general enrollment. That's an open season, and you'll notice for Medicare Part A, B, and D, the open season dates are October 15th to December 7th. Those dates nicely overlap your FEHB open season. This way you could coordinate your FEHB with your Medicare. So if you missed 1 year, you get it the second year. If you missed 17 years, you get it the 18th year. Every year there's an open season. And then the rightmost column is a special enrollment window. And this rightmost column, this special enrollment, only applies for those who are going to be retiring age 65 or later. Is there anybody in this room who's going to be retiring age 65 or later? Okay, so if you're going to be retiring age 65 or later, this special enrollment window applies to you. The special enrollment window is you have an 8-month special enrollment window that begins the month after your active employment coverage ends. Again, it's an 8-month window that begins the month after your active employment coverage ends. Now, let me ask you guys something. Is FEHB considered active employment coverage? If you have FEHB, is FEHB considered your active employment coverage? And the answer is, while you're actively employed, it's active employment coverage. But once you retire, it's no longer considered active employment coverage. Okay, so what I'm trying to say is, if you have FEHB, while you're employed, FEHB is considered active employment coverage. Okay, but once you retire, FEHB is no longer considered active employment coverage. It's still FEHB, it's just not considered active employment coverage. So when your active employment coverage ends, you have an 8-month window for you to enroll in Medicare. So let's give an example. Somebody who retires in February. So February is the last month of their active employment coverage. The next month, March, is the first month of this 8-month special enrollment period. Okay? Fine. Very, very good. Very, very good. Now, we just spoke about how to enroll. Let's focus on should you enroll. Should you enroll in Medicare? Please allow me to introduce you to the big bully. I call Medicare the big bully because at some point they start swinging at you with their threats of penalties. And they say, oh, Oh, you're thinking about not taking Medicare, are you? Well, we have penalties for people like you. Okay, what are the penalties? Okay, the penalties are a 10% premium penalty for every 12 months that you could have enrolled but didn't. For every 12 months that you could have enrolled and didn't, they smack you with a 10% premium penalty. Now, as you guys can see, there is no penalty for Part A because remember, Part A is free. So whoever gets Part A for free, there is no penalty for taking Part A late. Okay? If you get Part A for free, there is no penalty for taking Part A late. However, Part B, there is a penalty, a 10% penalty for every 12 months that could have enrolled, but you didn't. And the penalty never goes away. So let's think about this. If you missed 1 year and you enrolled in the second year, well, you're going to have to pay the premium plus 10% of the premium. If you missed 2 years, you're going to have to pay premium plus 20%. If you miss 3 years, you're going to have to pay premium plus 30%. If you miss 10 years, you have to pay premium plus 100%. And the penalty never goes away. Pretty scary, right? Pretty scary stuff. The big bully is very, very aggressive. Very scary bully. But do we have to be scared of the big bully? I have a couple reasons why you don't have to be scared of the big bully. Okay? Reason number one, penalties don't apply if you're still covered by active employment coverage. Meaning, if somebody is still actively employed and they have FEHB as their active employment coverage, Medicare cannot threaten you if you have active employment coverage. So anybody here who's going to be age 65 and still working, Medicare will not penalize you if you are still covered by active employment FEHB while you're working. And by the way, not only will they not penalize you, you know who else they're not going to penalize? Your retired spouse. That's right. Is there anybody here who is going to have a spouse that retires before them? If your spouse is retired, but they are covered under your active employment FEHB coverage, Medicare can't threaten you, and Medicare can't even threaten them. Now, when I say Medicare can't threaten, they will threaten. They will. My clients have showed me the letters. And those letters that they get from Medicare when you turn age 65, they're very pushy. They make it seem like you have no choice in the matter. They talk about you have to enroll, and if you don't enroll, there's going to be penalties, penalties, penalties. They're very intimidating, and people think that they have no choice in the matter. Let me set the record absolutely straight. Those are empty threats. Medicare cannot penalize somebody who is covered by active employment coverage. Okay? So if you are retired and you're covered under your spouse's working FEHB, Medicare can't even threaten you. They'll send you those letters in the mail, but those are empty threats. Okay? Fantastic. Okay. So that's one reason why you don't have to be scared of the big bully. Let me give you a second reason why you don't have to be scared of the big bully. And that's because if you see the penalties have a name. What is the name of the penalty? It's called late penalties. Meaning these are penalties for late enrollment. However, let's say I never enroll. Well then, if you never enroll, you're never late. I'm not joking. I'm not joking. If you never enroll, you are never late. And if you're never late, you never have to pay your late penalties. Holy moly. Are you guys hearing this? If you never enroll in Medicare, you never have to pay late penalties. Oh. wait a second. So if that's the case, will I ever enroll in Medicare? Especially if I'm a federal employee and I have FEHB coverage. If I already have FEHB, do I also need to have Medicare? Do I need both insurances? That's a great question. If you already have FEHB, do you need Medicare as a second insurance? Do you need two insurances? Okay. In order to answer this question, I want you guys to think about this, okay? I'm going to try to get you to answer these questions on your own, okay? So let's see if you guys can answer the following. For those who have FEHB right now, are you happy with your FEHB? Yeah, right? I'm assuming most people in this room are happy with their FEHB. So those who have FEHB, you're happy with your FEHB. Very good. If you were ever unhappy with your FEHB, can you switch to a different FEHB plan? Sure. During open season, of course. Every year there's open season. So every year you could switch. So if you're ever unhappy with your FEHB plan, you could switch to a different plan. Beautiful. Are there going to be open seasons in retirement? Yes. Every year there's open seasons even throughout retirement. So that means if you're ever unhappy with your FEHB plan, even in retirement, you will have the ability to switch your FEHB plan during an open season. So let me make sure I understand what you guys just told me. You're happy with your FEHB. If you're ever unhappy with your FEHB, you could switch to a different FEHB. You'll have the ability to switch during an open season. There will be open seasons every year for the rest of your life. So if you're happy with FEHB and you have the ability to switch FEHB plans every year for the rest of your life, please tell me, what am I missing? What am I missing? You're happy with your FEHB. You can switch FEHB plans the rest of your life. What am I missing? Did something about FEHB change when you turn to age 65? I know that Medicare is now an option, and I know Medicare is threatening you with penalties, but those penalties are only if you enroll late. And if you have FEHB and you're happy with your FEHB and you go and switch to different FEHB plans every year for the rest of your life, then did something change about FEHB? I know Medicare is now in the picture, but did something change about your FEHB that all of a sudden, when you turn age 65, you're now thinking, what do I do? What do I do? I don't know what to do. I don't know. Did something change about your FEHB when you turn age 65? Okay. And the answer is, there is something that changed. Oops. Oopsie. Let me see what happened over here. There is something that changed. Okay. What is the thing that changed? Here we go. Here's the thing that changed. I'm sorry, my slides got a little bit messed up there. Here is the thing that changed. Okay. The thing that changed about your FEHB is on the bottom of this slide, the bottom. But in order to appreciate the bottom of the slide, we have to talk about the top of the slide. Okay. You see, whenever you have two insurances, I don't care which two insurances, whether it's FEHB and Medicare or FEHB and TRICARE or TRICARE and Medicare or whatever. I really don't care. Anytime you have two insurances, there has to be a coordination of benefits. One of the insurers is going to be designated as the primary. One of them is going to be designated as the secondary, primary, secondary. Okay? Now, whenever you have a primary-secondary relationship, please tell me, which one usually picks up the bulk of the bill? Usually. Whenever you have a primary-secondary relationship, which one usually picks up the bulk of the bill? And the answer is the primary. The primary. Whenever you have a primary-secondary relationship, the primary usually picks up the bulk of the bill. The secondary, they only pick up whatever crumbs the primary didn't pick up. So whenever you have a primary-secondary relationship, The primary picks up the bulk of the bill, and the secondary picks up whatever the primary didn't pick up. Okay, fine, very, very good. So when I have FEHB and Medicare together, if I have both those insurances, which one of those is primary, which one is secondary? So if you guys can see on the slide, while you're employed, FEHB is primary, Medicare is secondary. When you retire, Medicare is primary, FEHB is secondary. Okay, so when you retire, Medicare is primary, FEHB is secondary. And again, remind me, which one picks up the bulk of the bill? The primary picks up the bulk of the bill. So that means if you're retired and Medicare is your primary and FEHB is your secondary, Medicare is going to pick up the bulk of the bill, and whatever crumbs Medicare didn't pick up, that usually falls to FEHB. So FEHB will be the secondary, and they will have only a fraction of the responsibility. Please tell me, when FEHB becomes your secondary and they have only a fraction of the responsibility, will they reduce your premiums? No, no, they will not. No, they will not. They're still going to charge you full premiums, even though they have a fraction of the responsibility. Can you imagine how excited they are as they see you approaching your 65th birthday and you're going to pick up Medicare? And FEHB is going to be the secondary with only a fraction of the responsibility, but still charging you full premiums. They are giddy with excitement. And can you imagine how profound their disappointment is? When you reach that age of 65 and you're supposed to take Medicare, but you decide, nah, I'm just going to stick with FEHB. Yeah, that's what I'm going to do. What do you think FEHB's reaction to that is? No, no, you were supposed to take Medicare. We were supposed to be in the secondary seat, charging you full premiums with only a fraction of the responsibility. We are profoundly disappointed. And guess what? FEHB has a recourse. What's FEHB's recourse? Check this out. Okay. The recourse is at the very bottom of the slide. Check this out. So let's read this very carefully. Retirees over the age of 65 who do not have Medicare, FEHB will pay the hospitals, Part A, and physicians, Part B, based upon Medicare rates. Ooh. Let me read that again. Retirees over the age of 65 who do not have Medicare, FEHB will pay the hospitals and physicians based upon Medicare rates. What does that mean, Medicare rates? So for those who don't know what that means is whenever you are working with an insurance plan, if you go to a doctor that accepts that insurance plan, what that means is that your doctor has entered into a contract with that insurance plan. And the contract clearly states that that doctor can only charge card-carrying members of that insurance plan a pre-agreed upon schedule of rates. Okay? You probably know exactly what I'm talking about. Has anybody here ever gotten a letter in the mail called the explanation of benefits? Okay, so the explanation of benefits tells you what happens. You went to the doctor for a paper cut. The doctor wanted to charge you $1,000 for the paper cut, but the insurance knocked it down to $100. So the doctor could only charge you the $100 because that's the rate, that's the reasonable and customary rate that they agreed upon, $100. What happens to the other $900 that the doctor wanted to charge you? Could the doctor send you a bill for the balance? Can they balance bill you for the $900? No, they cannot. That is illegal. It's a breach of contract. The only doctors that could balance bill are the out-of-network doctors. They could balance bill you. But the in-network doctors, it is a breach of contract. It is completely illegal for them to send you a bill for the balance. Okay? So every insurance plan has their schedule of rates for whatever services X, Y, Z. There's already the pre-agreed upon schedule of rates. That's also true for Medicare. Medicare also has their pre-agreed upon schedule of rates. And can anybody guess which schedule of rates pays the doctors more favorably? Is it the commercial plans through FEHB, or is it the public option through Medicare? Which schedule of rates pays the doctors more favorably? And the answer is FEHB pays the doctors more favorably. Medicare pays the doctors less favorably. So much less favorably that the doctors are looking at the situation and they're saying, wait a second. I'm doing the same work with both these patients, but for my Medicare patients, I'm getting paid so much less money. You know what, says the doctor? I'm not interested in Medicare patients anymore. Have you guys ever heard about this? Have you guys heard of doctors that are opting out of Medicare? And you know what? I totally get it. I totally understand where they're coming from. From a business standpoint, they're doing the same work and getting paid much less. From a business standpoint, I totally understand where they're coming from. And that's why many doctors are opting out of Medicare, because they're getting paid much less. Okay, now, Medicare rates are much less. The doctors get paid much less. Let's read this bottom paragraph once again. Let's read this again. Retirees over the age of 65 who do not have Medicare. FEHB plans will pay the hospitals Part A and physicians Part B based upon Medicare rates. Ooh, you know what that means? That means your doctors are now going to get paid Medicare rates. And remember, Medicare rates are less than FEHB rates. Even though you have FEHB, you don't even have Medicare. The doctor will be paid Medicare rates, which is not good news for the doctor. That's bad news for the doctor. They're going to get paid less money. However, does that in turn impact you, the patient? Could the doctor now stop seeing you? Could they say, you, 65-year-old who doesn't have Medicare, I'm not seeing, who doesn't have Medicare, I'm not seeing you anymore. Can the doctor specify you and drop you specifically as a client? And the answer is no, they can't. In order to stop seeing you, they have to stop seeing everybody who carries your insurance plan. Now, there are some insurance plans which are very, very small lines of insurance that the doctor might not care to have. But then there are other insurance plans which represent a huge chunk of the doctor's book of business, 10, 20, 30% of the doctor's book of business. For example, Blue Cross Blue Shield. Which doctor in their right mind would stop seeing Blue Cross Blue Shield patients? That's not just going to get rid of you. That's going to get rid of every third client of theirs. Which doctor in their right mind would do that? That's outrageous. So let's return to this question. By the way, I'm going a little bit overboard here. Okay, I'm sorry to go late with this class, but let's spend another 10 minutes together. Okay, let's spend another 10 minutes here. Stick with me, guys. Another 10 minutes. Okay. So, are you happy with your FEHB? Yes. If you're ever unhappy with your FEHB, could you switch to a different plan? Yes. Will you have the ability to switch in retirement? Yes. Every year for the rest of your life? Yes. So what changed that all of a sudden you're unsure of what to do? So you got offered Medicare. Yes, it's true, but did something change about FEHB? We pointed out something does change with your FEHB. What changes is your doctors get paid less money. But that impacts the doctor. That does not impact you. They can't just stop seeing you. So for you, nothing changes. So if nothing changes for you and you're happy with your FEHB, and you switch to to a different FEHB every year for the rest of your life, please tell me, do you need to have Medicare with your FEHB? I'm going to say it out loud, guys. I have two answers to this question. Do you need both? Answer number one, drum roll. Answer number one, no. No, you don't need both. Why should you have both? Don't you have FEHB? FEHB is comprehensive coverage. Why should I have a second insurance? Especially when the second insurance is just going to duplicate what my first insurance does. Okay? So, do I need a second insurance? Do I have to pay a second premium just to have duplicate insurance coverage when I was already happy with my FEHB? And the answer is no, you don't need that second insurance. You don't need both. Okay? Now, as I mentioned, if you're age 65 and collecting Social Security, you're going to have Part A. You're going to have Part A at some point. Okay? So really the question is going to boil down to Part B, the one that costs you money. So, do you need both? And the answer is no, you don't need both. Okay? That's answer number one. You do not need both. Now, let's go for answer number two. Is there a benefit to having both? You're right, you might not need both, but is there a benefit to having both? And the answer is yes. Does anybody here know? What is the benefit of having two insurances? So the benefit is, whenever you have two insurances, you have that primary-secondary relationship. Whatever the primary doesn't pick up, the secondary usually does pick up. And if you have the primary and the secondary picking up everything, your out-of-pocket goes to zero. Again, whatever the primary doesn't pick up, the secondary usually does pick up, and your out-of-pocket goes to zero. Oh, that's the benefit of having two insurances. The benefit is that whatever the primary doesn't pick up, the secondary usually does pick up, and your out-of-pocket usually goes to zero. That's the benefit of having two insurances. Now that we understand that, we can ask the next question, which is, okay, is it worth it to pay for a second insurance just to avoid the out-of-pocket exposure? That's the question. That's the crux of this entire Medicare conversation, isn't it? We have arrived at the crux of the issue. The crux of the issue is it worth it to pay a second premium just to avoid my out-of-pocket exposure? And can anybody guess what the answer to that question is? Is it worth it to pay a second premium just to avoid my out-of-pocket exposure? The answer is, it depends. What was your out-of-pocket exposure without the second insurance? Remember, every single one of your FEHB plans has something called an out-of-pocket maximum. Remember that word, out-of-pocket maximum? So what you need to do is you need to look at your FEHB plans, and you have to look at what is your out-of-pocket maximum. And then you have to compare your out-of-pocket maximum to the cost of the second premium, of the Medicare premiums. Oh my goodness, it's beautiful. In fact, I'm going to give you guys two examples. And I believe through these two examples, it should flesh out, the decision, okay? Here are my two examples. Okay, listen up, everybody. This is critical stuff, okay? So let's pay attention over here. My Medicare premiums, every year, $5,000. Every year, $5,000 Medicare premiums. In fact, as my income goes up, the premium goes up as well. But whatever. Let's just say my Medicare premiums are $5,000. My FEHB out-of-pocket maximum is also $5,000. So my Medicare premium is $5,000 and my FEHB out-of-pocket maximum is $5,000. Please tell me, is it worth it to pay $5,000 in Medicare premiums just to avoid my $5,000 out-of-pocket exposure? What do you guys think about that? Is it worth it to pay $5,000 in Medicare premiums just to avoid my $5,000 out-of-pocket exposure? And the answer is no, it's not worth it. It's not even a wash. Why not? Because who's to say you're going to have a $5,000 medical event? Why should I give away $5,000 in premiums just to avoid an iffy maybe $5,000 event? So in that case, it is not worth it to give away $5,000 in premiums just to avoid an iffy maybe $5,000 expense. Not worth it at all. Let me give you a second example. My Medicare premiums are $5,000 a year. My FEHB out-of-pocket maximum is $15,000 a year. $15,000. Is it worth it to pay $5,000 in Medicare premiums to avoid $15,000 out-of-pocket exposure? What do you guys think? Is it worth spending $5,000 in Medicare premiums to avoid $15,000 FEHB out-of-pocket exposure? And the answer is, it's not a slam dunk. It's not a slam dunk. It does depend on the likelihood of you having a high out-of-pocket medical event. Meaning, if you know that your health has declined and you're no longer in standard health and your health has declined seriously and you're having a lot of medical treatment, then it might be worth it. But let's say you had standard medical health. Like, think to yourselves, when was the last time you had a $5,000 out-of-pocket medical event? When was the last time that happened? It might be a while. It might have been a while since you last had that. If your health is standard like it has been, and you save your $5,000 Medicare premiums, guess what? After 3 years, you just saved $5,000, $10,000, $15,000. You just saved your out-of-pocket exposure. So if you avoid Medicare, you will have saved enough to cover your out-of-pocket exposure. Oh, and by the way, you only have to worry about your out-of-pocket exposure for just 1 year. Does anybody know why? Why do I only have to worry about my out-of-pocket exposure for just 1 year? And the answer is because if you see that your health has declined and you're going to have recurring out-of-pocket events, you could just switch your health insurance plan during open season to a plan with lower out-of-pocket exposures. Oh, man, it's so beautiful, isn't it? It's so beautiful. You only have to worry about your out-of-pocket exposures for 1 year, because if you see that you have a lot of out-of-pocket medical, you could switch to a more comprehensive FEHB plan during open season. Oh, my goodness. This is unreal. This is unreal. I hope I'm making sense to you guys. Now, it happens to be that TRICARE people, TRICARE people, you're going to have Medicare Part A and Part B. You're going to have it. So TRICARE people, because you're going to have Medicare A and B, that means you're going to have TRICARE, Medicare, and then the question is, are you also going to have FEHB? That's 3 insurances. 3 insurances. I was just trying to argue that 2 insurances might be overkill. 3 insurances is way overkill. So if you're a TRICARE person, you probably don't need 3 insurances. So the question is, okay, so if I'm not going to do all 3, then what should I do? So for TRICARE people, if you're not going to do all 3 insurances, here are your other 2 options. You could do the TRICARE Medicare combo and suspend your FEHB, as I mentioned earlier. You could suspend your FEHB using that form, that link that I put in the chat box. Alternatively, TRICARE people, you could suspend TRICARE. And if you suspend TRICARE, then you're not going to be mandated to have Medicare. And then you could just ride with FEHB. And remember, FEHB versus Medicare, FEHB is usually the cheaper way to go. So FEHB versus Medicare, FEHB is going to be the cheaper way to go. If you have TRICARE and TRICARE mandates Medicare and Medicare is more expensive than FEHB, then you're actually going the more expensive route. But good news for you TRICARE people. If you have TRICARE and Medicare, you're right, it's more expensive. Not thousands more, just a few $100s more expensive. But because you have two insurances, you'll have zero out of pocket. I do see a lot of my TRICARE clients going with the TRICARE Medicare combo. That's usually the way they go. Even though it's the more expensive option, just letting you know. I want to turn my attention to some questions. I know I went overboard. Let me spend a few minutes on the questions. Also, before you guys leave, I just want to remind you, if anybody here is interested in talking with me about FEHB, Medicare, TRICARE, financial planning, retirement, this is what I do. You guys can check on my website to learn what I do, and you can also click on the offers button on the sidebar. So if you guys see in the sidebar where it says offers, okay, you could check out that offer. And you could click where it says learn more, and you can request a session with me. And this way we could talk about working together. Okay, I really would love to do that. But right now, I'm going to turn my attention to some questions. So if anybody here has any questions, let's see. I have some questions. A question from Harriet. If FEHB and if I do FEHB and decline Medicare and doctor gets paid Medicare rates, can doctor charge you the difference? No. Harriet, great question. The doctor has entered into a contract with FEHB. They cannot charge you the difference. Okay? Denise has a question. Is enrollment in Part A B mandatory if the Social Security supplement is taken? No. Denise, when you say about the Social Security supplement, you're talking about the FERS annuity supplement. The FERS annuity supplement, just so you know, is not... The supplement goes away at 62. So Medicare kicks in at 65. So you're not going to overlap. The supplement and Medicare will not overlap at all. Francine has a question. If I choose not to take Part B, would the penalty run from April 1st or December 1st? Oh, Francine has another question. When does the penalty start to run? I retired this year on April 1st. So I believe I have until December 1st to enroll in Part B. Am I correct if I choose not to take Part B? So Francine, you retired April of this year, and I'm assuming you're already age 65, Francine. Okay, I'm assuming that's the case. And you have an 8-month enrollment period. So you have an 8 months, and then you have the open season at the end of the year. So the open season is going to enroll, and then it should start 12 months after you could have enrolled but didn't. So it's going to start of April the following year. Okay, so Francine, just you have an 8-month window. So April plus 8 months, I guess that takes you to December, right? I guess it takes you to December anyhow. And December is open season. So pretty much you have until April the following year, because it's 12 months from when you could have enrolled and didn't. Okay, great question. Adrian's asking, when should I cancel Part B? When should I cancel Part B? So Adrian, you could cancel Part B whenever you feel like you don't want it. There are ways you can do so. You could either cancel it. The easiest thing is to cancel it before it gets before it goes into effect. That would be the easiest thing. But if it went into effect, you're gonna have to send in a whole form to have it removed. Okay. I see that Sydney has a question. Once you decline Part B, you have to pay the penalty if you opt in a future date. Sydney, that is correct. That is correct. So Will is asking, are you familiar with what USPS is doing? Will, that is a great observation. For those who want to know what USPS is doing, USPS is now mandating that federal employees that USPS employees get Medicare. However, Will, the good news is that for those USPS employees that didn't have Medicare, they're not being penalized for not having taken Medicare. That's the good news. Okay, so there's some good news coming out of the USPS. It's a precedent that they are forcing federal employees to have Medicare, but part of that precedent is they're not penalizing the people who didn't. Okay. I see some other questions over here. Blue Cross Blue Shield out of pocket. I see a lot of people answer those questions. Blue Cross Blue Shield out of pocket. Okay. Okay, fine. Fantastic. Fantastic. It was really good connecting with you guys today. And I'm sorry the class went way overboard, but I'm hoping that this class delivered what you were looking for. And again, I'm happy to talk with you guys offline. So if anybody here is interested in a one-on-one consultation, just click on that offer on the side where it says learn more, and you can request that one-on-one consultation. You can also check out my website to see what it takes to work with me. I would love to have the opportunity to work with you all. I wish you guys a fantastic afternoon. All the best, everybody.